a couple minutes up after the hour, so we're going to go ahead and get started. We have a lot of information to cover here today. So I want to start off by saying I'm Jennifer Whitener, and I am the benefits manager here for Larimer County. Just a couple housekeeping items before we dive in. Everyone's microphone will be on mute, so if you have a question, please submit that question through the chat or our Q&A. And our benefits team is on the other side to answer those questions you might have. We will also share time to go through all of those questions here at the end of the presentation. This webinar is being recorded, and we will post this out on our benefits page at the end of this presentation. All right, well, let's go ahead and dive in. Today we're here to talk about 2026 medical plan changes. So we have two big changes that we want to talk about and make sure you're aware of for next year before we get to open enrollment next month in October. So the first big change is that we are changing from Meritain back to UMR. So prior to Meritain, going back to 2020, we were with UMR. So we are going back to them for next year. It is the United Healthcare Choice Plus network that we will be under, which is the network we were with when we had them previously. It's a nationwide network, which means that if you have kiddos in college, maybe in another state, or if you need to seek healthcare services while traveling, we have comprehensive nationwide coverage with network providers all over the U.S. In addition, any of your local providers here that you're familiar with, so UC Health, Banner, Women's Clinic, OCR, they all participate in the United Healthcare Network. So you should not see any provider disruption in terms of where you're receiving your healthcare services. Whenever we make a change like this, that means new ID cards. So you will get new ID cards mailed to you to your home address, whatever you have listed in UKG, and those will be sent out in December. And we've gotten this question a lot, so I just want to emphasize that we will be staying with CVS for our prescription benefits for next year. So you won't have any changes to your prescription drug benefits for next year. So the other big change, and where we're going to spend most of our time today, is talking about our medical plans that we'll be offering next year. So next year, there will be two plans to choose from. Right now, we have three, so we're going down to two. So the first is our Surest Zero Deductible Plan. This is a brand new plan that will be replacing the Choice and the Standard PPO plans that we have now. The second plan option you'll be able to choose is the High Deductible Health Plan, which we offer currently. So we really want to spend a lot of time talking about this new zero deductible plan and how it works, and a little bit how it compares to the high deductible plan. So in terms of the plan, it's just like it says. There's no deductible on this plan, and there's no coinsurance. So what that means is that you'll just pay copays. It's a copay-only plan, and you'll pay copays for your healthcare services until you meet your out-of-pocket maximum for the year. And I just listed what those amounts are for in-network below for reference. So it's $5,000 for an individual and $10,000 for family coverage. As I said, all you do is pay copays on this plan. And more specifically, this is what we call a variable copay plan. So with the Surest app or the Surest site, you'll be able to compare in-network providers and treatment options based on quality and cost. So those are terms that you should be familiar with, that we spent a lot of time educating staff around with the Healthcare Blue Book tool. That tool is essentially the same in the sense that you're looking up healthcare providers and procedures and evaluating their rankings, which are based on quality and cost. So it's that same concept, but now it's being directly incorporated into our plan design. What's nice about this plan is that you'll know the cost before you go. So on the Surest app and the Surest site, you'll be able to look up if I'm going to be planning to have a baby next year, what that cost looks like. Or if I go to Dr. Smith for a primary care visit, what will that copay be? And what's included all in that copay? And we're going to get into some more detailed examples for you in a minute. I will say that right now, Surest is building our Larimer County specific app and site, and that will be released here in October prior to open enrollment. So today we're just going to be looking at some examples to help just get you familiar with how the plan kind of looks and functions. But the site that will have our actual information, that's going to be sent out here hopefully in the next few weeks. So in determining what that copay is going to be, as I said, high level, it's based on factors of quality and cost. So let's get into the details on how that works. So with the Surest plan, you'll be able to compare providers based on their care rating. So it's a scale of 1 to 10, 10 being the highest, best care rating you can have, 1 being the lowest. And so there are various factors that go into how that care rating is scored and assigned. And this is just a high-level summary of what they're looking at to assign that care rating. So they're going to look at things like, for that particular provider, how often are they trying proven treatments that are lower cost and less invasive before recommending someone for surgery? And what's the success of those earlier intervention sort of treatments for care? If someone does have to have surgery, they look for that patient book of business they have, and they're going to look at how many of those patients had surgical complications or hospital readmissions. How effective is the provider in preventing infection in their patient base? And then just overall, how efficiently are they using resources? Are they referring patients to out-of-network providers or facilities for care? Are they performing services in office at a lower cost versus referring those out to higher cost facilities? And then, of course, overall, just what are they charging for the services they provide? So again, just like we've said with Healthcare Blue Book, the cost for the healthcare service you receive varies depending on who your doctor is and where you go. So that is no different compared to today to our new plan next year. That copay may vary by the location you're going to for the same service, depending on those care rating factors that I was referring to. So in this example on the left, you'll see what those factors are that they're looking at for a knee replacement. So the provider care rating is going to be factored on complication rates, readmission rates. Did that provider require the patient to have physical therapy in the hospital after that knee replacement, or did they have them go to an outside lower cost setting for that? The hospital where they had the surgery, do they use a lot of out-of-network anesthesiologists or assistant surgeons to help with that procedure? Or are they using in-network providers? They do look at overall just average patient risk score. So in general, for their patients having knee replacements, are we seeing the health score for their patient book go up or down over time? Because you certainly would hope that would be their health scores would be improving over time. And then generally also looking at what's that average length of stay that someone's having to stay at the hospital for having a knee replacement. So the example on the right here, again, it's going to be a very different set of factors that go into assigning that care rating for a primary care office visit compared to a knee surgery replacement. So you'll see here for an overall score for a primary care provider, it's going to be factored based on overall how are they treating various conditions across their patient book. So they're going to look at how do they manage their hyperlipidemia patients, their patients with type 2 diabetes, patients with respiratory infections, low back pain. So they're looking at various different categories to come up with that care rating for the primary care provider copay. And so when you dig into that further, you can see again the factors that they're using to evaluate how well they're managing their patients, in this example, with acute respiratory infections versus their patients who are type 2 diabetics. The metrics are very different. So for those with an acute respiratory infection, they're going to look at what percent of their patients are they having use high-cost imaging, what percent are using diagnostic procedures, what percent are using high-cost diagnostic labs or ancillary services, what percent of those patients are going to the ER or urgent care with issues related specific to acute respiratory infections. Same for hospital admissions. And again, overall patient risk scores. Are we seeing those patient risk scores improve or decline over time? And you can see then for a type 2 diabetic rating, they're looking at things like what percent are using injectables, what percent are using devices to track and monitor their A1C, for example. Again, it's very specific. What percent with diabetes-related ER and urgent care visits are their patients having? Various eye care or surgery services, what percent are having that? Or foot amputations? What percent are being done, visits are being done through virtual care? And again, looking at overall patient risk scores. So it's very detailed and a very complex methodology that Surest is using to assign these provider care ratings. And in one more example here, I wanted to show you what that looks like for something like a maternity copay and what goes into that rating. So again, they're going to look at what percent of deliveries are done as a C-section, what percent of babies have short stay NICUs, less than 4 days, what percent of their patients use an epidural, what is the percentage use of high-cost imaging or ultrasounds, are their patients getting the required prenatal visits and ancillary services that they should be receiving prior to delivery? They're going to look at the baby health risk scores and the mother health risk scores. And then just overall, what are the facility charges for where they're delivering babies and the average length of stay for the mother and the child. So again, very different set of criteria that are used here compared to what we saw in the prior examples for a knee surgery or a primary care visit. I do want to note that the care ratings and copays assigned based on those care ratings are reevaluated on an annual basis, and they will not change during the course of the year. And in terms of the look back period, because we did get this question around patients who had been seeing providers at Village Medical who have left and gone, to UC Health or Banner, and what does that look like? So the care rating is based on a historical 3-year period. So it's a look back period where they're gathering that data from United Healthcare's entire book of business to establish that care rating for the following year. So if a provider changes, from one office to another health system, that data is still evaluated and captured again on a look back basis. So another highlight of this plan that's very different from the choice and the standard plans now is a simplified experience in terms of billing and payments. So, on our plans now, if you need a surgery or a procedure at a hospital, you have to pay multiple bills for each service included in the procedure. And it's very hard to understand what your total cost will be for that procedure. And it varies from person to person based on where you're at with your deductible and coinsurance for the year. And you'll usually get an estimate from your healthcare provider for what that cost will be, but it's never right. And so it's a very convoluted process. You might end up paying more money up front than you need to, and then have to spend a lot of time trying to get a refund on the back end. So it's a lot of work on top of you just trying to manage your health from having whatever procedure or surgery that was needed. So, what's very nice about this Surest plan is that it's a bundled copay approach, meaning you pay one copay for a procedure, even when multiple providers are involved. So, the Surest plan bundles all those related services into a single member encounter. So, it's one copay, one bill. I wanted to provide an example here of what that actually looks like. So here is the breakdown for someone who's having a baby. So this is the maternity bundle example, and that copay range is going to be $900 to $2,000, depending on where the baby is being delivered. But what all is included in that copay? Well, it includes your initial history and physical exam, all routine prenatal visits and exams, the recording of vitals of your baby, as well as routine labs and prenatal ultrasounds in the office, the actual delivery itself, whether it's vaginal or C-section, routine postpartum visits, and then also a breast pump is included in that single copay if that's something that you need. So again, it's start to finish, one single copay. All right, this next slide is going to give you a visual comparison of how this Surest plan compares to the choice and standard plan that we have now. So if we start up at the top, just as I said with deductibles, the Surest plan does not have a deductible. The choice and standard plans now have deductibles. The Surest plan has no coinsurance, whereas our current plans do. The out-of-pocket maximum, again, for single coverage on the Surest plan is $5,000, and for family, it's $10,000. So it's actually a slight decrease from the out-of-pocket maximum for those who are on the standard plan today. Any services received at the wellness clinic, that will continue to be no cost for anyone on the Surest plan, as well as any services for Teladoc. Remember, Teladoc is your virtual care app that you can use for general Medicare medical services, dermatology services, as well as behavioral health services. And that is a 24/7 service that you have access to. And then preventive care services, those will continue to always be paid at 100% for preventive care. Now, this is where you can see that variable copay plan design really start to kick in. So in terms of your doctor's office visit, right now on the Choice and Standard plans, it's just a $25 copay. On the Surest plan, it will be a range. It will be between $20 to $105, again, depending on the care rating of the provider you are seeing. Mental health office visits, right now it's a $25 copay per visit, and it's an open network. So it's a $25 copay, whether that provider is in network or out of network. Next year, that copay will decrease to $15 per visit, but it is for in-network only visits. So it will need to be with an in-network provider. So Family Care Center will fall under that $15 copay. Specialist office visits, currently it's a $50 copay. Again, that will be a range of $20 to $105, depending on where you go and what type of specialty it's for. Urgent care, right now it's a $50 copay. That will be a $60 copay on the Surest plan. Emergency room is currently a $200 copay. That is a $650 copay on the Surest plan. And I should note for urgent care and emergency room, that will always be the copay, whether or not it is in-network or an out-of-network facility. So urgent care and emergency room services, it is the same copay wherever you go. In and outpatient hospital services, just as I described on the previous slide, I can't tell you what that cost would be right now because, again, it's deductible and coinsurance, and it will vary person to person depending on where they're at for the year. But with the Surest plan next year, it's a copay range of $150 to $3,000, again, depending on what the procedure is and where you're going. But we'll know what that copay is up front, and we can look that up on the Surest site or the app and be able to confirm that prior to having your procedure done. Massage and acupuncture. So for those of you who know someone who attended a previous webinar, we actually have an update to this benefit specifically that we wanted to bring up for everyone here today. So massage and acupuncture, currently it's a $25 copay and an open network, meaning it's $25 whether you're in network or out of network, with a $1,000 limit. We were able to negotiate this with the Surest plan for next year based on feedback we were getting from local massage therapists and acupuncturists in our area, so that it will remain an open network benefit next year for massage and acupuncture. There will not be a dollar limit, but there will be a capped 50 visit limit. We do want to be transparent because with the change to the Surest plan and their platform, there are just certain things that they aren't able to administer on that platform that will be sunsetting at the end of this year. Or in the case of Healthcare Blue Book, it just will no longer be necessary since the Surest platform will essentially be doing the same thing. So Healthcare Blue Book will end at the end of this year, as well as the $500 lifestyle education program. Anything where we had a $0 copay, the $0 copay will go away because that's just not an option we had. But I wanted to highlight Banner and Family Care Center and Colorado Motion in blue because they will still be in network next year. It's just that they will no longer have a $0 copay. There will be a copay, that would be required when using these providers next year. In addition, the doula benefit, the Regenix coverage, Grail testing, and sensory deprivation coverage will end next year. These are just services they are not able to administer on the platform. I did want to just interject here very briefly for anyone who's attending who's on the high deductible plan, that we don't have a lot of changes to that plan for next year, other than the deductible will be increasing, just to make sure we're staying in compliance with IRS guidelines for next year. So we've listed those in network amounts below. So for individual coverage, it's going up $100 from $3,300 to $3,400. And for family coverage, it's going up by $200 from $6,600 to $6,800 for next year. We are still able to offer health savings account, HSA employer contributions under the high deductible health plan only. There's no change to those amounts. So we've listed those here for you just as a reminder. And again, those are contributed on a per paycheck basis. So because we're going from 3 plans to 2 plans, we wanted to just kind of break down the math for you in terms of the medical premium changes. So for those of you on the choice and the standard plan, if you were to move to the Surest plan, you'll see the financial impact outlined here. So if you're on the choice plan and you move to that Surest plan next year, your rates are going to drop significantly. They will either plan you take, because the choice plan was, a Cadillac level plan. The standard plan, you'll see a slight dollar increase depending on what tier of coverage you elect. So that range is $4 to $16 increase per month. And then for you on the high deductible plan, for single coverage, no rate change for single coverage. And then you'll see the range here from $8 to $14 increase per month for the other tiers. As I mentioned, open enrollment will be in October. It is October 27th through November 7th. And just as it has been for the past several years, it is again a mandatory open enrollment, especially with the changes being made to the medical plan. We want to make sure everyone goes in and makes their appropriate elections for next year. So that's why we're trying to be out and be in front of this now and help you to plan ahead. So we're going to be doing various department staff meetings to remind you about open enrollment and things to be thinking about over the next several weeks, as well as we'll have campus office hours at certain locations. Our benefits team is always happy to schedule an individual one-on-one appointment with you or with you and your significant other. And you can do that by request. And if you think you have a provider you're going to that's not in the network, you can reach out to us, to the benefits team as well. We can verify that for you if they're in the network for next year or not. And if they're not, we're happy to help work with you to reach out to your provider to see if they would like to join. So all questions, the best way to get a hold of us is to email just our benefits team inbox. It's HR_benefits@larimer.org. And I included a QR code here. Please do scan that QR code. It's going to take you directly to our Surest site, where we're regularly including updates and resources for you to access and use. And so I'm actually going to go there right now. So we can take a look at that. So this is just on our general Larimer County page, so you don't have to log into the B board to see this. Anyone can see this, it's out there now. And you'll see that we've got tabs up at the top. So we'll have our recording posted here of today's presentation. We have our medical premiums here, if you want to refer to those. You'll also see we've got some helpful resources, including a more detailed overview of the Surest plan and what it looks like. So this is going to show you in-network and out-of-network copays. You can also see the high deductible plan overview. Again, just being able to compare those in and out-of-network benefits. We have a comparison here that shows you just kind of that breakdown between the choice and the standard plan and how that compares to the new Surest plan. So really helpful information, including a comparison between just the two plans being offered next year. And then you'll see we've got a very thorough FAQ going that we continue to add as we get frequent questions from staff and family members. That is also out here for you to take a look at. So bookmark this page. I highly recommend it. Once our Larimer County Surest page is up and running, we will have that site link top and center for you to be able to go in and access. So on that note, I did want to give you just a demonstration of this Surest site and what it looks like to give you a better feel, because sometimes it's easier to just see a visual of this. So this is a demo site only. I want to preface that this is a demo site only with fake numbers, just to give you an example. So the copays you're about to see or the care ratings you're about to see are just for example purposes only. They are not real numbers, and we're just using this to help you understand kind of the platform in general and how it works. So in this example, I just want to go see my doctor and I want to know what that copay is going to be for an office visit. So I'm going to click Find Providers. And then it's always going to show me my lowest cost options at the top. So we'll have a tile up here to remind you that Teladoc is a $0 benefit. We'll have a tile here for the wellness clinic. But if you go to a specific doctor and you want to see them, then you can either search by their name up here or go through the results down below. So you'll see when you go to the site, it's always going to list the provider with the highest care rating and the lowest cost first. So Dr. Schmidt has a care rating of 10. That's the best care rating you can have. And his copay is $15. But say I go to Dr. Cash, and that's my primary care provider. Well, Dr. Cash has a care rating of 7. And so the copay is higher. The copay for Dr. Cash is $35. So it's a pretty simple example here. Let's look at something a little bit more complex. Let's look, maybe I'm gonna, let's go back to the baby example. I'm gonna have a baby. So we would go and look at birth for a maternity delivery. And so again, it's going to very easily list for you what is the highest care rated, lowest cost option in terms of delivering a baby. So in this example, you'll see that the UC Health Greeley Hospital and Lawns Peak Hospital have the highest care ratings and a copay of $900. Now, scrolling down, if I go to MCR, that care rating is lower. It's an 8, and so the copay amount went up to $1,000. If I look at Poudre Valley, you'll see the care rating is 8, but that copay is higher at $1,400. So if you want a reminder of what all is included, you can see here and click on what's included. And again, it's going to outline for you all the services that fall under that copay. So you can have that handy to refer to. And then you'll see another summary down here below. So it's really meant to be a very intuitive tool and very user-friendly, which is why we like it. And again, this is just a demo site, but something we wanted to be able to share with you so you could start to get an idea and a feel for what this looks like and how it works. Now, as I mentioned, we're going to be doing open enrollment webinars throughout the next several weeks leading up to open enrollment. And so we're going to be continuing our series of doing a weekly live webinar. So starting next week, if you didn't see this in Inside Information on Friday, we will start our open enrollment webinar series. So the goal of that open enrollment webinar series is going to give you a more detailed breakdown between the new Surest plan and how it compares to the high deductible health plan, and then talk about any other updates for our other benefits that we need to cover, as well as just give you a reminder of how to complete open enrollment in UKG. So we have the dates and the links to register for those posted out on the bulletin board. And we do have a Saturday on there. That's not a typo. We did that on purpose because we want to try to capture as many significant others that we can. So your spouse and dependents who might be interested in learning more about this. So that is here. We need a minimum of 10 people to do it. So if that's of interest to anyone, or if you think your spouse might be interested in listening in on that one, you'll want to make sure to register for that. All right. Well, that being said, I'm going to go ahead and pull my slide up with the QR code again, just so we have it if you want to scan that and bookmark it for yourself. And I think we're ready to turn it over to Q&A time. So benefits team, whoever would like to start, let's go ahead and get through those questions.
Great. One of them was the QR code. So you were ahead of that. Thank you, Jennifer, and pulling that back up. And then one of the questions that I couldn't answer was if Height of Health is going to go in network with UMR. I know they had thought about it and saw the what they were going to get paid. And so will they still need to do out of network charges for that? Like if they go to a massage, they'll have to file that on the portal?
Correct. Yes. So Height of Health Massage has decided to not join the network for next year. So they will be an out-of-network provider, which means you will just need to fill out the Surest claim form for that. And we've already shared that with the Height of Health team, so they know what it looks like, and they will help their patients fill that out. And then you'll just upload that to the Surest portal. So very similar to now, where you'll do the claim submission on your end to make sure you only have to pay the $25 copay.
Great, thank you. Lauren, Kathy, do you have any? I saw a few come in, but I'm going to try to read these and answer them before I pull you in, Jennifer.
I just have a few, just a couple, just to make sure. So does the website show which factors are impacting a provider's rating?
No, so
Okay.
not to the level of detail because the Surest plan considers that proprietary and confidential information. So it's not going to show you like the specific equation per care rating. But if you're curious in just general factors that are used or applied for a particular provider or service, that is something that you can reach out to the benefits team for, and we'd be happy to request that and provide you that information.
Thank you. And then another question is, will there still be massages offered at the wellness clinic?
That we haven't discussed in full transparency, so I can't say yes or no at this particular time. So TBD on that one.
Cool. Thank you. Well, that is all the questions I had in the chat.
Thanks, Lauren.
Thank you.
Kathy, anything on your side? Or Rachel?
Sorry, there's still one Q&A that I was reading. It's asking about the provider rating taking into consideration the actual medical condition. So Jennifer, if you want to speak again to how that rating is kind of spread amongst patients and the years, that might answer this question.
Sure. Yep. So let me go back to that part of the presentation. So again, those care ratings are truly going to be different for depending on the type of visit you're going for, and the type of patients that a particular provider may treat. So in this example here, when we looked at primary care providers, they're overall going to look at how are they treating patients with this type of condition, hyperlipidemia. Whole set of factors different for someone with type 2 diabetes. Different set of factors apply for someone with respiratory infections. And so that was what this example was here, to give you a feel for each of those types of patients that they're treating and what factors go into that overall care rating score. So they do risk adjust. So if you're going to a provider that treats very complex health cases, they do take that into account. So a provider is not being penalized because they're really good and they treat very complex, patients who might have multiple chronic conditions. So Surest does account for that in terms of the factoring of that care rating. And again, it's a look back period. So they're looking at the past 3 years of data for United Healthcare's entire book of business that are being seen with those providers. So does that help to answer your question, Rachel?
Yes, it sure does. Thank you.
You bet. Oop.
There's a question on the premiums. Jennifer, do you want to show where those are on that site?
Sure. We'll go back to the Surest site here.
This site truly is, there's so much data on here. Jen Glover built this for us and it's amazing. So these are the 2026 per paycheck costs. So premiums, and you can just take note of the wellness versus non-wellness. And quick reminder, because I wouldn't be me if I didn't say this, but the deadline is coming up. So jump in and navigate, make sure you have that well rate.
Yeah, and I'll just leave this screen up while we scan through for other questions. We do not have any other information to present to the group today, so if your questions have been answered or if you need to just follow up with us individually, you're welcome to leave, and we will stay on here for another couple minutes in case we have any other new questions come into the chats.
don't see anything else coming in on my end.
Nothing on my end either.
Okay. Well, we'll go ahead and end today's presentation. We want to thank everyone for your time and for attending, and also for all the great questions we have been getting from folks over the past several weeks. It's been really helpful to make sure that we're getting information out that's clear and concise, and that we continue to build on that to make sure that we're giving you the most information we can so you feel educated and ready to make your medical plan choice when open enrollment comes around next month. So thank you again for your time today, guys. If you have any follow-up questions, please reach out to the benefits team. We are here to help you as we go through this transition and be a part of this process. So thanks again, everyone, and we'll go ahead and end the webinar. Have a great rest of your day. Bye.